right, so it is June the 5th, 2015. I am here this morning for my pre-op visit for my breast reduction. Pretty excited, as you can tell, and this is actually my second time being here because of some mishaps that happened as far as my FMLA and insurance. So I'm going to go ahead and show you guys the room. This is the pre-op room. And over there, where that blue is where I will be standing up and taking pictures that will be sent off for insurance purposes. So I'm going to wait a few minutes, and the doctor should be in, and I will see you guys then. Okay, bye. Alrighty, so one more last look at the pre-op room. It's not a very big room. And I'm just waiting for my brochure so I can go off to the next appointment to talk to anesthesia. Bye. Hey guys, Please Believe It here. I just wanted to go ahead and do a quick video about my breast reduction journey that I'm currently going on. This is something that I have been contemplating on for many, many years, and just recently I started having neck pain. I've always pretty much had back pain, but recently it's gone all the way up to like my neck. I have the grooves from my bra straps. I don't know if you can see that really good, but that's just from having large breasts and having now having those grooves, which it really sucks. Those of you out there that have large breasts, I'm sure you guys can relate to me. You know, you have an imprint of your bra, you have the grooves on your shoulders, and it's hard to sleep sometimes because your back is hurting, or you kind of have to make yourself as comfortable as possible, and sometimes you just can't. So I talked to my primary care physician, and we felt that this would be in my best interest that I go ahead and have the breast reduction. Currently, I am a 38 double D, and I am a petite 5'1", so I'm packing around a lot of weight, and so I really just want to get rid of it. And I know there's people out there thinking, well, you know, you're supposed to love your body, and you're supposed to love your breasts, and da-da-da-da-da-da. But I do. Don't get me wrong, I do. But at the same time, they are causing me a lot of physical pain. And if there's something that I can do to prevent having physical pain, then I'm going to do it by all means. So let me jump right into it. These are some things that that you need to do. So I'm going to be looking at my notes too. You need to talk to your primary care physician, and he or she will refer you to a plastic surgeon, and then from there they will set up a consultation/appointment to see if you are even a candidate for this type of surgery, and then from there they will take photos of you. And if you remember the first portion of this vlog, I showed you the room that I was sitting in, and it had that blue wall inside. Well, that's pretty much where you would stand in front of that wall. The nurse and the doctor will take pictures of you. You will turn facing towards the doctor, so it's a frontal shot of your breast, and then they will do a side shot, and pretty much that shows, you know, if your shoulders are rolled forward, how your posture is, etc., etc. Your doctor will just ask you a few questions, such as how small you want your breast to be. And then while the doctor's evaluating everything on you, the nurse will be taking notes, and then the doctor will pretty much go over the notes with her once the visit is over. And then they would submit the notes to your insurance company. And then from there, your insurance company will send you a letter. They will contact the surgery center while you will be having this done, and the doctor, and basically say yay or nay if you are approved to have the surgery. Hopefully you will do a lot of research. That's pretty much what I did. You will do a lot of research and find a very good plastic surgeon that will take really good notes and evaluate you very well, so that when it's time to submit all the information to the insurance company, you will get approved. That's pretty much how you get approved. You have a doctor that evaluates you to like the highest level and can get you that green light for you. Because if your doctor does like a poor job on your evaluation, 9 times out of 10, the insurance company is not going to approve it. But it is a medical condition. A lot of insurance companies, they don't want to see it that way. But within the past 5 to 7 years, breast reductions has grown to a rapid rate, anywhere from like 33%. I believe that's what I had read on an article. So for me, I got my approval letter from my insurance company, and they said that they wanted me to have removed a total of 338 grams. That's just, I guess, standard for that particular insurance company. And that was something I was a little worried about. And my doctor assured me, he, pretty much said, hey, we are going to take what we need to meet what they want. And so when he said that, I kind of looked at him like, so does that mean I'm going to be flat-chested or what? And he was just kind of like, no, what that means is I will make sure that I meet the requirement, but you will still have, the perfect size for your body type. I told him I wanted to be a full C, and that's roughly 36, 38. I don't want to go over. And I do know that once you start to gain weight, there is a possibility that your breasts will grow. They will get a little bigger, but they won't be like they were prior to a surgery. Okay? So let me hurry up and go through this, because I'm going to do another video and I'll get more into depth as far as like the insurance process. Okay? These are the top 5 questions that I went in with for my surgeon. Number 1, how long will the surgery take? Usually doctors, they can't give you an exact time, just an estimate, because there could be complications during the surgery. And then there could be more that they would actually have to do once you get on the table and they open you up and see what's going on. So, but the rough estimate is usually anywhere from an hour and a half to up to 4 hours. Okay, that's just rough estimate. Everybody's different. Everybody's breasts are different. So just keep that in mind. It could be anywhere from an hour and a half to 4 hours. Okay. Second question I had was, how long of a recovery period could I expect, and what kind of help will I need during my recovery? Your doctor will probably tell you need anywhere from 2 to 4 weeks off from your employer. There's absolutely no heavy lifting of over 10 pounds. So don't try to be Superwoman as soon as you have your surgery, thinking that you can go pick up all these heavy sacks of groceries, or you know, pick up your children and do all this crazy stuff. Relax, okay? Just relax. You need to recover properly. And this is just to ensure that you heal well, and risk doing damage, because if you do not follow the recovery procedures, you can risk tearing, scar tissue damage, and then ending up having to come back to the hospital and have another surgery to fix this stuff. And insurance won't cover that, just FYI. So that is why it's very, very imperative that you follow the doctor's recovery procedures, because if something were to happen and you had to go back and have surgery again, insurance will not cover this. And this, I heard this from my own doctor's mouth, okay? So when it's time for you to have a bath, you need to make sure you have somebody to help you bathe if possible. I know some people can't always have somebody there with them 24/7, but it is, you know, a good idea to make sure you have somebody that can help take care of you during your recovery time, and as well as when you are coming home from the hospital, or coming home from the outpatient surgery centers, that you have somebody that can drive for you, because you're not going to be able to drive. They do not want you taking a bus or a taxi. They want somebody that can be with you during this whole process. And that can help you also get out of bed, get to bed, etc. My third question was, will I be able to sleep on my stomach? That's generally how I sleep, is on my stomach. Unfortunately, I will not be able to sleep on my stomach, which is kind of a bummer. I was told I was going to have to make sure I have some pillows that can prop me up, keep myself elevated for a short period of time. But once, after, I think, I'll say, give or take 1, maybe 2 weeks, I should be able to move around a little more and sleep on my side at least. There's a few videos on here that I've watched, and you know, most of the girls said that within a week and a half, maybe 2 weeks, they were able to start sleeping on their side again and started to actually feel comfortable. Will my insurance cover the surgery? That was the fourth question that I asked. The doctor will not be able to answer this question. However, he said that he would do a very thorough evaluation letter to the insurance company to get that approved. He said that he shouldn't have any problem getting that approved, and he was totally right. He didn't have any problems getting it approved. So I did receive my letter within the week. Alright, so my fifth question for the doctor was, will I be able to breastfeed? Okay, so he did say it is possible. However, if your nipples are detached, meaning taking off and moved, there's a possibility that some of your milk ducts will be cut. That means that the milk production following pregnancy could be decreased or reduced. If breastfeeding is still possible, however, it might be necessary for you to supplement with formula, okay? Which, for me, it was no big deal, whatever. The fifth question was, what surgical technique is recommended for me? Essentially, there are 4 techniques for breast reduction mammoplasties. Within these 4 basic types of procedures, there are multiple variations. The main 4 types are the wise pattern or anchor incision that puts an incision around your areola and down to the inframammary crease, so it'll go like an anchor. The second one is the vertical, or it's called lollipop or keyhole, which eliminates the inferior inframammary incision. The third one is the transverse, and that uses only the inframammary and periolar incisions. Then there's liposuction alone. Pretty much they'll just suck out the fat, you know, on your sides, and then I guess they'll go underneath and suck the fat out. Let's see. Yada, yada, yada. And then the type of breast reduction technique selected for a patient pretty much will depend on several factors, including, will just pretty much include size and position of your breast, as well as elasticity and pretty much your patient goals. For smaller reductions, lifts, vertical skin excisions, or lollipop incisions are good. A wise pattern or a anchor incision is good for larger breasts and large reductions with poor skin quality. So for myself, because I have larger breasts, it's going to be a good idea for us to go ahead and do the anchor incision. So that's what we agreed upon. And I'm not really worried about scarring or anything. I just want to get this done so I can feel better and feel just like I can just sit up without forcing myself to sit up. Because even right now, I'm like having to force myself to sit straight, because otherwise I'll catch myself like slumping over. So that's where I'm going to end this video here, and I will do the third part of this vlog talking about insurance. Okay? See ya.